Hi, so my name is Rayees. I'm a student at the Icahn School of Medicine at Mount Sinai, and I'm the CEO and co-founder of Canairy. And we are building a platform to monitor respiratory health. We're building a platform to monitor respiratory health in patients with chronic respiratory diseases. So let's listen to a demo. Hey Alexa, what's the weather like for today?
Currently, in New York, it's 41 degrees Fahrenheit with cloudy skies. We noticed your voice has changed. Can we take a sample of your cough?
That okay?
It seems that your cough has some signature similar to an upper respiratory infection. I have sent some information about screening services to your phone.
Hey Alexa, what's the weather?
Fahrenheit with cloudy skies.
Thank you. So chronic respiratory diseases are a huge problem. They're the fourth biggest killer in the United States after heart attacks and cancer. And this problem is massive. Almost 100 million people suffer from chronic respiratory diseases every year, and it costs the United States $150 billion per year in terms of costs and maintenance. But this problem is getting worse because of our increasing pollution and urbanization levels, because of a rapidly aging population, and because of the high prevalence of new smokers. But this is not a macro problem. This problem takes place individually on a personal level. So let's talk about a patient I know named Teddy. So Teddy is a 2-year-old boy, and for the past 2 months, he's been suffering from a chronic cough. And his mom has taken him to an ENT, to his pediatrician, to his allergist, with no avail. He finally sees a pulmonologist who thinks, just based on his age and based on the cough, that he probably has asthma. So he prescribes him with some steroids, some inhalers, and tells him to come back in 6 months. 6 months later, at the follow-up appointment, Teddy's cough hasn't improved. And his mom doesn't know, is it better? Is it better? Is it worse? Is it the same? And his physician, can't really make a judgment call as to if it is asthma anymore because he's not responding to the therapies. So he does a bronchoscopy and discovers that Teddy does not have asthma. He has tracheomalacia, which is a collapse of his breathing airway. After 100 customer interviews, particularly with patients and people and physicians, we discovered that Teddy's situation is not unique. Patients want a way to monitor their respiratory health over time. They want agency in their disease, and they want to be able to know whether or not they're responding to treatment. Physicians, on the other hand, want a way to quantify a cough in terms of its severity, in terms of its character, and in terms of its frequency. And they want a way to analyze a cough such that they can predict or classify what sort of disease it may be. So our solution is to develop a machine learning algorithm that takes an audio sample of a cough and compares it every single time you do a cough or your voice, and sort of detects changes in a patient's cough or voice over time. But before we can continue, we have to do our homework and see if this is actually a machine learnable problem. And so when we did our literature review, we discovered that many types of coughs have distinct signatures of what type of disease profile they're a part of. As you can see here, asthma coughs are very distinctive from bronchitis coughs, from pneumonia coughs. And so from that information, we can take those cough signatures and apply them to our collection of 2,000 coughs and cluster them based on these disease signatures. We can then develop an algorithm that measures and tracks changes in a person's cough or voice over time, and then alerts the patient if it's a significant difference. Canairy, as a result, can be on anything. From a smartphone app to our demo today, which was on an Amazon Alexa, patients can monitor their respiratory health anywhere, at home, at work, and Canairy syncs to the cloud. So a physician using his physician dashboard can get alerts to changes in respiratory health of their patients. Canairy sits on a really interesting enterprise in terms of how it will get its money, or how we will make money. So our initial pilot study will focus on a B2B play, focusing on a subscription as a service model. Physicians, clinics and hospitals will pay Canairy a subscription fee per patient to prescribe Canairy to their patients. And this fee will cost $15 per patient per month. Physicians, on the other hand, will get reimbursed by Medicare and insurance companies, typically on the order of $100 to $150, based on very new billing codes that they can bill back to the Center for Medicaid Services. And Canairy will work with insurance companies to make more billing codes across many different types of insurance companies. Next, we envision academic partnerships, where Canairy will work with academia or even industry partners to license our technology for discovering new respiratory cures. The total market size for respiratory health is huge. Respiratory health alone is about $41.3 billion, and our target market, which is just digital health for respiratory care management, is going to reach $550 million in 2023. And Canairy occupies a unique value proposition compared to all of our competitors. Our secret sauce is our personalized voice model and the fact that we can longitudinally track a patient's cough and voice over time. Our platform is unique. And our go-to-market strategy involves 2 distinct pilot projects in tandem with a major healthcare institution in New York City. Our first study is going to test whether or not our mobile app is useful for parents with children with asthma. And so parents will use our asthma app to monitor their child's disease. Next, we will work with the World Trade Center Coalition to classify coughs from first responders of the disaster. The next 3 to 6 months is incredibly busy for us. We'll be working on our IRB approvals, we'll be working on our mobile app and dashboard development, and we'll be submitting an SBIR later in the year. But Canairy is not these 3 to 6 months, and we have a long-term vision for Canairy. A lot of diseases can be screened based on changes in voice, and building this type of platform will enable us to screen patients in the future for neurodegenerative diseases like Parkinson's and ALS, or for respiratory disease and infection. Our team is, in a word, spectacular. We come from a wide variety of disciplines and training areas that can bring Canairy to life. And our advisors are top-notch and has been guiding us for the past 3 to 6 months incredibly well. We've also accomplished a lot in these last 3 months, from winning the NYC Grand Hackathon, to participating in this accelerator program, to being interviewed by Y Combinator and being finalists for business model competitions. Before I conclude, I'd like to invite my team up on stage. Without them, none of this could have happened. And to conclude, Canaries once served as warnings for toxic environments, so we wanted to build an AI to be like a canary, something that doesn't change how you live, but is capable of warning you before it's too late. Thank you. On behalf of the